have the honor of having been involved with Check Your Genes during the development of the family history notification tool. And really, the main impetus behind developing the family history notification tool was just that as genetics professionals, we knew that there were large portions of the time in which patients were having difficulty or were feeling very limited in their ability to communicate this information with their family members. We know, that the patients who have the greatest risk of having a BRCA1 or 2 mutation are going to be those that are directly related to individuals with BRCA1 and 2 mutations. As a brand new genetic counselor more than a decade ago, probably one of my first patients that I ever counseled and tested who came back positive for a BRCA2 mutation went about her way. She was actually a healthcare professional herself, so she did a really good job of informing her immediate family members, and a few people from her family got tested. And about 4 to 5 years after that, I met another patient, a 26-year-old with a very aggressive triple-negative breast cancer, and it turned out that this individual, the second patient, was about a 6th degree relative to that original patient that I had tested years before. And it wasn't that, there was any error on anyone's part. It's just that sometimes we don't think of how far out our relatives are that we should perhaps be concerned about. And really there was a very direct link between the cancers for these two women, and ultimately the 26-year-old did not survive for breast cancer. So this is very important information for us to be able to help families to spread as far as possible. Hence the Family Notification Service. So the Family Notification Service was originally designed for patients with positive BRCA results, and it's really to kind of help streamline the process for patients. They've obviously just gone through the difficult period of time learning that they have a mutation. They're making a lot of management decisions about their own care, and now they have this additional burden of needing to notify as many family members as possible. So Check Your Genes developed the secure, free family notification service to help patients directly to notify their family members about their test results. So this is a screenshot of the entry page of the family notification service. And so from this, you'll see that we have a little bit of a welcome page that lives on the Check Your Genes website, and we just ask that our patients who will be returning to the website enter in their email address and create their own password so that this is something that is secure and private for the individual patient. Once you have created your information and login password, it does ask you for a little bit of information about yourself. Really, the highest degree of privacy kind of location-wise is just your zip code and state, and this is all, as I had mentioned, done completely securely. And then you enter into the home section. Now, what you'll find on this section are templates that are very similar to the one that Sarah went over as a suggestion as to how you might communicate with your family members. So we have established a couple of different templates that you can work from. You can utilize them in one of two ways. They are set up so that you could merge names into them and print them out and mail to your family members who might be more easily communicated with by mail. And then we also have email templates as well. The email templates can be set up to be sent directly out to your family members. So this is an example of the opportunity to edit one of the templates. So it comes with a subject line. Now, the default subject line that is in there does say urgent, I tested positive for BRCA1 and 2 in one of the two options, and that might be a little concerning for some of your family members, so you might change the subject. It's completely at your discretion, but really this is a very significant issue that we do want our patients and their family members to know about. And so the email body then loads, and you'll see dear where it says hashtag recipient. That will self-populate based on the family members' names that you enter in. And then there's an amount of text that you can change. And then you close and save any changes that you've made to the template. The template that we have in there does have the Genetic Counselor Finder tool, which lives on the NSGC, or the National Society of Genetic Counselors template. That is a helpful tool because it can actually help people to locate genetic counselors within a radius of their home, which might help them with the type of information. Now, You have multiple template options. You can save as many of your own templates as you'd like. You can actually basically start from scratch. You can use some of the sample letter templates that we start with. Some of the sample templates that we have in there, one is called positive result letter. This means these are family members that you are comfortable being direct with, and it basically says, I had genetic testing and my test result is this. You are at risk for this mutation and you may wish to talk to your medical professional as soon as possible or at your convenience. The second one is called family increased risk letter, and this might be better for patients who are slightly more comfortable with a more vague statement, but still want to inform their family members of potential risk. So the family increased risk letter talks a little bit more about the fact that a patient has perhaps been diagnosed with a breast cancer or recognizes that breast and/or ovarian cancer runs in their family, and they want their family members to be aware that that is something that could impact their health as well. So it's much more gentle. It's not as specific and direct in mentioning a particular genetic mutation. And then at the bottom, towards the bottom where the arrow is, you'll see that you can save multiple templates for the different levels of comfort with your various close and extended family. And after that, you'll enter in your contact details. So who is this going out to? So that first name, last name, that part where it's required, that's used to basically self-populate those letters. So dear mom, this happened, and then you kind of indicate for here, and there's a way to help yourself to keep track of whether or not you're emailing this information out to particular family members or whether it's going by regular mail. So you'll save. Now if it's going by regular mail, you'll have to print that out yourself. There's not a magical mechanism by which it arrives at your printer. So you would be responsible for the printing and mailing part. But the emailing part, the tool will take care of for you. In addition to some of the functionality we've described, it is also possible to attach a PDF of your test report. So everyone who's having testing at this point in time, your genetic counselor or your healthcare provider who has ordered that test for you, is probably getting your test result one of two ways. Most are still actually getting it both by fax to their office and then a PDF copy by email or by a secure portal as well. So if you contacted your healthcare provider, especially for testing that has been done in 2012, 13, and on, we all pretty much have a PDF copy of your result that we could certainly very easily make accessible to you. And for genetic counselors who may be watching, moving forward, obviously this is something you can discuss with your patients up front, the availability of the PDF to provide to them that they may wish to readily share with their family members. So you'll go ahead and attach that. And then really it's as simple as just have 3 buttons, send your emails. So you click send emails and they magically arrive in the inboxes of your family members. So when to share? The sooner the information is shared, the better. Really, a delay in sharing the information can result in the diagnosis of another family member. And the whole goal really of having this type of information is to try to prevent cancer diagnosis. I mean, Jim said it best in the beginning. Really, the goal of Check Your Genes is to make people aware so that we can do something about the overall incidence of cancer. And really, it's a very personal issue for the families of our patients. And it's just devastating to hear there's another individual who has been diagnosed because we hope that with the knowledge and some opportunities for prevention and additional choices that cancer can be prevented. We do talk with our patients about being mindful that genetic testing is not typically recommended for minors, and therefore this information is generally to be shared with adult family members. In BRCA 1 and 2, we do often take into account the age of diagnosis of a patient. And so, for example, that family I mentioned at the beginning, where my second patient was 26. In that family, although we would typically start BRCA 1 and 2 management at about age 25, we started with the other girls in that family between the ages of 16 and 18, or about 10 years younger than their youngest diagnosis. There are genetic conditions, in particular polyposis cancer, colon cancer syndrome, in which we do test minors and consider some other options. But for a condition like BRCA 1 and 2, it's really a concern of adult onset. So we're primarily talking about your adult family members. After sharing, when you're undergoing the process of sharing the test result, it's important to respect your family members' decisions about testing. We've been running a support group here in Cincinnati for a number of years, and I know that a lot of our mothers and and fathers of adult children are often very concerned about the choices that their adult children are making, whether or not to test, the timing of testing. So it's very important for the individual who is going to have the test to be comfortable that this is information that they want to have, rather than feel as though they're being rushed into a decision. So we really encourage family members to think through a positive test result and a negative test result, and what different types of actions they would take with that type of information. We want to give family members time to speak with their own medical professionals and help them to become informed. And also, you are sharing this information with them. I think it's important to have a little bit of dialogue too about whether you're open to reciprocity. Is this something that you want to continue to discuss as a family? And then really one of the most important things is it's important not to pressure any family members in decision making one way or the other. There are studies that have looked at surgical decision making and other things that women may do after learning of a diagnosis. And generally, the individuals who feel certain that they want to have a mastectomy tend to be those that are the happiest with their decision to have a mastectomy afterwards. And so it's very important for people to be in a place where they're comfortable with the decisions they might make on the basis of a genetic test result. After sharing, there is also some report of noticing a potential change in family dynamics. Some family members may become closer than before because of their genetic status. I have a family also, though, that I've been working with recently where the mother had passed away from an ovarian cancer, and a number of family members were coming back positive, and I finally got a daughter who came back negative. She had 3 daughters herself, so this was tremendous news for her nuclear family. And her exact words to me were, "It feels kind of crummy." And there is a real phenomenon called survivor guilt, where our patients do experience guilt about not inheriting the increased risk for cancer when they have tested negative. There's a lot that goes on in terms of emotions and family dynamics and the psychosocial issues that surround families. It's important to be prepared for that when you're at a point where you're sharing this critical information.